Hello everyone. So today we're going to be talking about influenza, and basically this condition known as influenza is also commonly referred to as flu. So whenever someone says they have flu, they are referring to this condition known as influenza, and is a highly contagious viral respiratory infection and is primarily caused by the influenza virus. So it affects the nose, the throat, and the lungs, and it can range from mild to severe illnesses. So sometimes it might even lead it can even lead to hospitalization or death if not treated properly. So influenza is a major global health concern, and it usually comes with seasonal outbreaks occurring yearly, like around the cold season, like during the rainy season in Nigeria now, or the winter periods in Europe. So it usually occurs during this time and is a seasonal condition. So it usually occurs seasonally, yearly, and occasionally. Pandemics are caused by like emerging strains. So the virus spreads primarily through respiratory droplets. When an infected person coughs, like I just did now, when an infected person coughs, sneezes, or talks, so it can spread by touching the contaminated surfaces and then touching the face. So let's say the person coughs on, this is a table now, person coughs on a table, sneezes on a table, and you come and just decide to lie down on that table or rest on that table. So that is how it's basically transmitted. So when you like rest on that table, then you use that hand to come and touch your face. So this is how it's transmitted, by the respiratory droplets of the person that has the condition. So influenza can affect individuals of all ages, but severe cases are more common in high-risk populations such as young children or elderly adults, because they have lower chances of fighting off infections, pregnant women too, and immunocompromised individuals. So these are known as the high-risk populations, and they are prone to getting more severe cases of this flu or influenza. So when we are looking at the etiology of this influenza, that is the causes. So influenza is caused by viruses belonging to the family Otomyxoviridae, and there are four main types of influenza viruses. There's influenza A, influenza B, influenza C, and D. And I'm just going to break each of them down and explain them differently. So when it comes to influenza A, it is the most dangerous type because it is capable of infecting humans, infecting birds, infecting pigs, and other animals. So it is responsible for both seasonal flu epidemics and is also responsible for pandemics due to its ability to undergo major genetic changes, like we call this antigenic shift and antigenic drift. So basically influenza A is the most dangerous type. Then we have influenza B, and influenza B only affects humans and is generally caused by seasonal outbreaks. So it is not as variable as influenza A, and it does not usually cause pandemics. So it does not have these genetic changes that influenza A has. Then when we're looking at influenza C causes mild respiratory infections, and it usually does not lead to epidemics or pandemics compared to influenza A and B. And then for influenza D, it primarily affects cattle and has no impact on human health. So out of all the influenzas, influenza D is the one that has no impact on our health. So influenza viruses, they are basically characterized by two key surface proteins. They have hemagglutinin and neuraminidase. So the hemagglutinin helps the virus attach to the host cell and enter the host cell. Then the neuraminidase, it helps the virus break free from the host cells and spread to new ones. So these are the major two key surface proteins that we can see on the viruses that helps them to transmit this infection. So when it comes to the signs and symptoms of influenza, so influenza symptoms, they develop suddenly, usually within 1 to 4 days of exposure of the virus. So we could see common symptoms like fever, often very high, like between 38 to 40 degrees Celsius, chills and sweating, cough, could be dry, could be productive, you could be spitting out something. So you could have both kinds of cough. Then sore throats, runny nose, severe muscle and body aches, fatigue, headache. There could also be loss of appetite, and the major sign and symptoms that cause the most illness is vomiting, diarrhea, nausea, and this is usually more common in children than adults. So when we're looking at the clinical presentation, patients with influenza, they often appear ill, tired, fatigued, and have flushed skin. And fever is usually the hallmark sign, but it may not always be present, especially in elderly individuals or those with weakened immune systems. So some individuals, they develop complications, including complications like pneumonia, which often presents with worsening cough, difficulty breathing, and chest pain. So the clinical presentation is basically different for each person, and we see more severe presentation when it comes to immunocompromised patients and elderly patients. So when we're looking at the risk factors, so generally in cases of all kinds of infections, some individuals are higher risk of developing severe forms of these infections related to others, in comparison to others. So for example, now in the case of this influenza, now children under 5 years old, especially under 2 years old, whereby their body is still trying to adapt to a lot of things, so they are at a higher risk of developing influenza related complications. Then adults over 65 years old, pregnant women and postpartum women that just recently delivered, like up to 2 weeks after delivery. Then individuals with chronic illnesses, like for example asthma, diabetes, or if you just have if you just have an illness already that you already had pre-existing illness before this influenza, you are at a high risk of getting complications. Then immunocompromised patients like HIV and AIDS patients, cancer patients, because they don't have, their immune system cannot really fight off infections like the way normal people are able to. So they are at a higher risk of getting complications in terms of any illness that they pick up. Then we also have obese individuals, like individuals that have a body mass index of greater than 40. So having a body mass index of greater than 40 is not very healthy at all. It's very dangerous, and so you are at a higher risk of getting complications of influenza. Then healthcare workers and caregivers that take care of patients, basically if you are working in the healthcare system, you are exposed to a lot of patients with a lot of different conditions, so you are at a higher risk too if you don't wear proper protective gear and so on. So that is it about the risk factors. Then when we're looking at the diagnosis, So accurate diagnosis of influenza is essential for proper treatment and prevention of complications. So diagnostic methods, they often include like we do clinical diagnosis based on symptoms and physical examination, especially during the season where there's predominance in flu, like the cold season where everybody's getting the flu. So we do the clinical diagnosis. Then we also have something called rapid influenza diagnostic test. So this test detects viral antigens within 15 minutes, but it has a very low sensitivity. Then we have something called reverse transcription polymerase chain reaction. So this is the gold standard when we are diagnosing this influenza, and it's highly sensitive and specific, and it easily detects influenza RNA in respiratory samples. So you just get maybe the droplets of the patient, the respiratory droplet of the patient, then we use it to perform this test and we'll get the diagnosis. So it's highly sensitive. It's the most sensitive out of all the tests that are used in diagnosing influenza virus. So we can also do viral culture too. This usually takes several days. It's not as quick. So it usually takes several days and is mainly used for research. It's not really used for hospital diagnosis because it's too slow. So it's usually used for research. And then we have serology tests too, which are rarely used but can detect past infections of influenza. So when we're looking at the pathophysiology of influenza, so influenza primarily infects respiratory epithelial cells, leading to widespread inflammation and immune activation. So the virus basically, it attaches to the host cells using this hemagglutinin that I talked about before, hemagglutinin proteins. It uses it to attach to the host cells. Then after attaching, it enters the cells and it replicates inside the nucleus. So it replicates inside the nucleus and releases new viral particles through the help of the second protein, neuraminidase, and this allows the virus to spread. So it usually causes cell death, and an immune response is usually what leads to the symptoms we see, like fever, headache. So this is basically the breakdown. So severe cases may progress to acute respiratory distress syndrome due to excessive activation and inflammation. So this is basically the breakdown of the pathophysiology of this influenza virus. So how do we manage this influenza or flu? The management. So first, we have to give supportive care. So supportive care you could just tell the patient to try to stay hydrated, because staying hydrated is very good. Sometimes most of the problems we have is because we are not hydrated enough. Even me myself, most of the time I'm not really hydrated, but that's not what we're talking about here. So supportive care is very good, like rest, hydration, then antipyretics to help with the fever, to bring down the fever, like giving paracetamol or ibuprofen for the fever, and also pain relief too. Then in severe cases, the patient might need like oxygen therapy, so that could help too in that case. Then then for antiviral medication we can use for this condition. Usually antivirals are most effective when started within 48 hours of the symptom onset. So let's say you are having the typical symptoms now. Let's say you are having fever, chills, all those symptoms, and you start taking the antiviral medicine within 48 hours. 48 hours is 2 days. after the onset, so it's more effective than taking it after a longer period. So examples of these antiviral medications, we have neuraminidase inhibitors. So like I said, neuraminidase is one of the proteins that helps this virus in replication, and basically these inhibitors, they block the neuraminidase enzyme, preventing the viral release from the infected cells, and this reduces symptoms and the duration of the illness, and is usually recommended for high risk individuals like pregnant women, immunocompromised patients, immunocompromised patients, and for example, we have examples like oseltamivir, zanamivir, and we also have another example of antiviral medications like cap dependent endonuclease inhibitors like marboxil. So this antiviral medication inhibits the viral mRNA. It inhibits the mRNA transcription and stops replication, so it's effective as a single dose treatment. And then we have adamantanes, so like amantadine, rimantadine. So basically these antiviral medications, they target the M2 protein of influenza A, but they are usually no longer recommended due to their high resistance. So these are the other antiviral medications we can also give for high risk individuals, together with supportive treatment. So when it comes to prevention of this flu or influenza, the most effective way to prevent influenza is annual vaccination, and other preventive measures could include hand hygiene, like washing your hands with soap and water, wearing masks in crowded places, avoiding close contacts with infected individuals, covering your mouth and nose while you are coughing or you are sneezing, disinfecting commonly touched places in your workplace. So this will prevent the transmission of this influenza. Then when we are looking at the prognosis of this influenza condition, so for most individuals, influenza is self-limiting. Like it usually resolves by itself after a few days. So symptoms resolve within like 7 to 10 days. But when you have severe cases, it may lead to complications such as pneumonia, which could be bacterial or viral, exacerbation of chronic diseases. Like if you have asthma, it could exacerbate it. If you have heart failure, it could exacerbate it. Then complications like myocarditis, that is inflammation of the heart, encephalitis, brain inflammation, and then in worst cases, multiple organ failure, especially in critically ill patients. So high risk individuals, they may require hospitalization and intensive care support. So annual vaccination remains the best strategy to reduce this disease severity and prevent outbreaks. Prevent outbreaks. So that is all about influenza virus. So I forgot to add, besides for the symptomatic relief of this influenza, besides giving paracetamol or ibuprofen for the fever and the pain relief, we could also give drugs for nasal congestion. Like for example, we could give pseudoephedrine, which comes in form of like Sudafed, and we could give antihistamines like loratadine, cetirizine. Then we could give dextromethorphan in cases of dry cough. Then productive cough, we could give guaifenesin. Then for sore throat, we could give lozenges, tell the patient to do like warm salt water gargles, and other cares like rest, hydration, and we could the patient could also do like steam inhalation. So there's this particular steam inhalation that I used to do since I was younger. Like I'll take rub, and I'll put it inside hot water, and then I'll put my face, I'll cover my head with like a towel and put my face and be inhaling the steam. So I do it for like sometimes I do it for a week, sometimes I do it for 3 days, and it's very helpful. And these are just like supportive therapy that you can do besides, away from medications, non-pharmacological treatments that you could do. And you could encourage the patient to take warm fluids like ginger, tea. So that is basically it.